We're about to tackle a topic on the minds of many Americans these days. It's our nation's healthcare system. Hello and welcome to The Big Picture. I'm Mark Quinn. From coast to coast, this has been the summer that many of us have fiercely debated the idea of healthcare reform. So this week, we spread out across the state and even beyond to get ideas and opinions about reform from a wide variety of sources, people who work in healthcare every single day. How America ultimately overhauls the healthcare system is still open to a long, tough debate. But one of the things most of us agree upon is that an overhaul is overdue. If you see what I did this past weekend in the Tennessee countryside, you might hope that overhaul comes sooner than later. It's just after dinner time in the waning days of summer in rural Roane County, Tennessee. The community college here is 65 miles west of Knoxville. And with folks leisurely encamped in the parking lot, it has the look of people waiting to watch a Friday night football game.
There was a bunch of us activated during Katrina, for instance.
Only there is no joy here, no excitement, certainly no fun. This is the unseen reality of American healthcare for some of the less fortunate among us.
We do our best to afford the medical insurance, but as far as affording dental and vision, that's just not an option for us at this point. And we are certainly not the only people in this boat, trying their best to work every single day to provide for our families. But there's things that we lack, and dental insurance being one of them.
Missy and Bill Rodgers are from nearby Maryville, married 17 years, 3 kids. Bill has worked steady his whole life as a paint contractor until the housing bust. Now it's sporadic. The two had saved up $400 to have some dental work done this fall until a few weeks ago. That's when their oldest daughter made the varsity cheerleading team. Dental work would wait.
Yeah, it's packed. I ain't got that place to put anybody anymore.
I need 700 to 750.
Waiting is what many did Friday night. Before sunrise Saturday, hundreds of people were lined up to get health care, free of charge, no questions asked, from a nonprofit group called Remote Area Medical.
Number 12. Number 13.
With a fixed amount of patients they can realistically see in one day, tickets are handed out on a first-come, first-served basis, and the hours are not patient-friendly.
I got in at 2 o'clock this morning, and we just got lucky to get to right here. We had some friends to come in, and they was parked on the other side of the parking lot over there, and they told them that they wasn't giving no more numbers out. They went back home.
706.
The sun, still an hour from rising, meant many standing, sitting, or camping out in the dark. They are the faces of the down and out, the dispossessed and impoverished, the out of luck, or those who never had any luck at all.
Or you just needing some glasses.
But once they were in, there were no insurance cards, no co-pays, and no deductibles. Just volunteer nurses, some like Nancy from South Carolina, EMTs, and doctors of every kind, ready to work from sunup to sundown.
I just didn't expect so many people to be so down on the luck, that kind of stuff. You don't really think about it when you have a job or when you have insurance and those kinds of things. You don't really think about it. And I'm retired and just thought, well, I'll just volunteer for one of these things. And it just really has blessed me. It's touched me to see so many people that can receive help through this organization.
Thank God for something like this, but it's a sad sight at the same time. It's a lot of people. This is their sole means of health care and dental care, or coming to these Ram Mission clinics, showing up early on a Friday, sitting in line all night. I mean, it rained all week, the few days prior coming into here, and they still sat out there waiting to be seen. It's
not exactly the most dignified of sights, if you ask me.
No, not at all. But thank God for this organization.
On this day, Remote Area Medical will extract and fill hundreds of teeth. It's one of their biggest demands. But they'll also see hundreds of patients with no insurance that covers their vision. RAM can make more than 400 pairs of glasses in a single day. They do it in the back of an 18-wheeler, retrofitted as an optometry lab.
This could be the answer for us, if that's what you're asking me. If we had more people in more of these clinics, which they're trying to get legislation in more states to have these remote medical clinics. And I think that would help a lot of our situation in the country with the current medical insurance crisis.
That's one thing, just from your general opinion, if we had, let's just say we placed this down in Woodruff, South Carolina, do you think we'd see the same kind of crowd?
Oh, I certainly do.
Then the man to make that happen would be Stan Brock, founder of Remote Area Medical Care. He initially spent his early years bringing first world medicine to third world countries in South America. Now he spends most of his time in rural Appalachia.
For a small community like Roane County, Tennessee, to have 600 people turn up here because they can't get the care they need really is a disgrace in the world's richest country.
Stan Brock's goal is simple. He wants to export this type of camp all across America, a program that relies solely on donations, volunteers, and takes no government money. But there's one problem. Tennessee is one of the few states that allows out-of-state doctors to volunteer their services in scenes just like this. Most states, like South Carolina, have laws that only allow doctors licensed in that state to administer care. The South Carolina General Assembly has researched the opportunity to change the laws here, but like many states, the movement has gone nowhere.
If you were to talk to the dentists and the eye doctors today here at this operation, you will find that most of them are from other parts of the United States. They have a valid license in their own state, and they're allowed to provide free care here in the state of Tennessee under these conditions. This needs to be the law in South Carolina. It needs to be the law in California, where we just were a couple of weeks ago, where I turned away thousands of people because the state of California would not allow us to bring in people from outside the state to help.
By 9 a.m., just 3 hours after the doors had opened, more than 230 patients had been seen by a doctor. 200 more were just outside the doors, and hundreds more were still in the parking lot, just waiting for the day to pass, in hopes their number would be called. Dianne Pitts and her husband are South Carolinians who have made remote area medical their enduring passion. The entire weekend, room, board, and time, all on their own dime.
Every clinic I work, I come away with stories that sit in my heart, okay? One clinic we went to, one of the doctors came out and was saying he had never been so amazed. He had a lady who had actually heated a metal coat hanger and had self-cauterized some areas in her mouth because she was in such pain. I mean, let's admit it, that is pain, and when you can't get help at the doctors or can't afford to get that kind of help, it's desperate measures. It's desperate times in healthcare.
Before we packed up and left, a last encounter with Missy Rodgers. You remember her from Friday night. Now, her teeth work done, she was just waiting on her husband. Happy it was almost time to go home, wondering quietly why, for the two of them, their health care had come to this.
But I can tell it's just it's emotional for you, isn't it?
Yeah, it's a little, like I said, it's a little disheartening. You just wish it wasn't, that you wish you didn't have to go to this extreme to have basic dental care.
You folks seem like the folks that kind of know that, like, life is hard, but does it need to be this hard?
Well, we have high hopes that it's going to get better. We really do. We believe that our country is strong. We believe that our government is smart, and we hope that they can figure it out like everyone else.
The totals from Tennessee and their weekend there, more than 1,400 patients seen in less than 2 days.